Joining us now is Illinois Deputy Governor Christian Mitchell from the Thompson Center, the governor's office building, the suite of offices there in downtown Chicago. Deputy Governor, it's good to have you with us.
Good to be here. Thanks for having me.
I know I've sort of seen some of the behind the scenes and talked to a few people in the governor's office there. I know that it's sort of a hectic situation these days. First of all, can you provide an update on the state's effort to go out and buy this personal protective equipment, these gloves, these masks, gowns, and face shields that doctors and nurses need? Has that process, as chaotic as it has been, is it improving? Is there any sign that it's becoming easier for the state to track down these important pieces of equipment to help protect doctors and nurses?
Well, I think we've been successful in doing some of that work, and I think it speaks to the really, really good team we have here with Central Management Services, the Illinois Emergency Management Agency, and our Department of Public Health, and the strike team we've been able to put together. But to your question of whether it's gotten easier, the answer to that question is most certainly no. As you probably know, but as I want to share with your viewers, part of the challenge we have is that it really is the Wild West out here, and in so many ways, where the federal government could have stepped in, used the Defense Production Act, taken the middleman out of the equation so that we weren't dealing with a friend who's got a cousin who's got a guy. Because that did not happen.
We're having a little bit of a lag here. I think we have you saying because that did not happen, and then we
competing against other large states, New York, California, Wisconsin, and Michigan, who we've tried to be collaborative with. We're also competing with the federal government, and in many cases, we're also competing with foreign countries that are seeing their peak coming and are doing their very best to try to get ahead of it. So the truth is that the process has not gotten any better, thanks to the federal government not being the market mover. But having said that, I think we're doing pretty well. I think we're starting to get some of the stuff we need. We're chartering flights from China to get stuff here. It's been difficult.
I apologize, there was a little bit of a lag there. You were starting to say because that did not happen, because the federal government did not fully enact the Defense Production Act, and it's a little choppy there, but I think I understand most of your point. But that's the interesting thing. So we've talked about how the president's reticence to use the Defense Production Act has created chaos in chasing down the supply, but is it also ratcheting up the cost, and by how much?
Yes, so absolutely, you are seeing massive price spikes and price gouging. You know, normally an N95, I'm told, I'm not an expert on this, but I'm told it's about $1.50, maybe $2 a mask. You're seeing prices, if you're lucky, in the $4 to $5 range, and in many cases as high as $8, $10, $12. If you look at ventilators, for example, a low-end unit, one that is non-invasive but can still do important work, it's going to cost you, let's call it $13,000, $14,000. Those units are going to be somewhere between $18,000 to $25,000, $26,000. And if you were looking, for example, at an ICU ventilator, one of the deluxe units that really can do a lot of really good work for someone, those are normally, let's call it $35,000 to $42,000. Those units are going for $64,000, $65,000, $70,000. And that's the market we're fighting in. And the question is, do you try to wait for the market to return to normal? Well, no, you don't have time. So you end up paying a premium because, if you don't, you're going to lose life that you otherwise could have saved.
You said you don't have time. There was the interesting story, I believe, in the Chicago Sun-Times that tracked a state employee who had to get in their car and drive with a check worth several $1 million just to meet up with a supply. What else are you seeing like that in this sort of, you mentioned the Wild West. I mean, people are literally getting in their cars, driving across the state with checks in hand just to procure this box of shipment.
Yeah, well, it's Lord of the Flies. I mean, you're in a situation where effectively you'll have a deal that you think is pretty done, pretty cut, and someone will say, well, if we don't get payment in the next, 12 hours, we're going to have to move that shipment on to another state, another country, someone else. And so, that's not typically how state procurement works. Typically how state procurement works is we say we want to buy this many of this thing, and we put up an offer sheet. And someone says, well, I can do it for this cost. Now what we're saying instead is we need this many of these masks, these gloves, these gowns to keep doctors and nurses protected. How much is it going to cost us? And in that environment, you're in a situation where you've got to do what you've got to do. You've still got to try to vet people. You've got to run them through processes, but it's a very imperfect process because you're never dealing with the direct supplier. So if the federal government had just said, hey, 3M, we're taking over production or whatever the company is, and we're going to do distribution based on the numbers we've seen. Now we're not competing against each other, and there's no middleman. We're not in a situation where we're talking to, a venture capital firm or someone else who's gone out and bought up a bunch of masks. We're talking directly to the person who has the product. And we don't have that luxury because we're out here competing against other states and other countries.
Prior to your becoming a deputy governor, you also were a campaign animal, worked in the campaign side. I wonder if maybe you appreciate the governor's usage of the term burn rate when he's looking not at campaign finance dollars to spend on a campaign, but on measuring how quickly doctors and nurses are chewing through this inventory of these masks. As you're evaluating that number, are there any healthcare sites where they've run out, they've been depleted, and you've had to restock them? How close are we getting to running on empty here?
Yeah, I mean, and ideally, you want to make sure that folks have 10 days of burn rate on hand. Are fortunate that we are not quite at our peak yet, so we've seen some situations where folks have been very close to running out, we're able to resupply, but we're anticipating that unless we get a massive influx of shipments of goods, that you could see a situation where we could see people running on 2 days of supply, simply because you've got to do everything you can to keep as many hospitals, FQHCs, first responders, EMTs afloat. And so, yeah, I think we're absolutely going to run into that sort of shortfall soon. We have not seen a huge critical shortfall yet, but that is also because we think our peak is probably a week or two away.
On Thursday this week, WGN reported that there were 3 North Suburban hospitals who already reached their capacity for intensive care. And we know that that may look different in different parts of the state. Downstate, you have hospitals that are laying staff off in droves and saying, hey, go to the unemployment line, get unemployment insurance, we'll let you know if and when you can come back and have your job. So how does the governor's office speak to the different issues that are happening in different parts of the state all at once, where some places are full, other places are so empty they're having to lay staff off?
Well, so it's a really good question. I think part of what you're seeing, and you're seeing this around the country, state of New York, other places, that it's not just a single peak for the state. It's really a series of peaks depending on where you are. And when you look at the city of Chicago and that sort of the county region, you're looking at a place that has O'Hare Airport, that has a lot of people going through it every single day, and so it's going to get hit first. And so those hospitals are already in a situation where ICUs are, in some places at a critical capacity. If you're further downstate, the hope is that our social distancing measures mean it will never get as bad there as it might get in the Cook County region and the five collar counties. That would be great. But what's more likely to happen is that just because you have fewer people moving through, that peak will be later. And so what we're doing is we're working with the local counties, we're working with the local cities, we're building out alternative care sites to make sure that if that rush happens, we are ready for it. What I'd also say is for anybody who is looking for work in healthcare, if they can make their way up north, there's plenty of folks that need help here. We're seeing issues with congregate care facilities like nursing homes and our Department of Corrections facilities. So there is a lot of need for heroes to lace up here, and we're asking for that.
The governor has said at least twice in his recent daily press briefings in 2 different instances that he would get personally involved with hospitals. 1, if any of them would refuse a patient from a prison, or 2, in order to help play traffic cop, essentially, to send a ventilator from a place where it may not be needed today to a hot spot where it's needed yesterday. So the governor does seem like he's having these phone calls with hospital CEOs. Will he make, or has he already had those same hands-on conversations with hospital CEOs, like at OSF, where they announced they're furloughing a whole bunch of people? Can he go there and say, hey, that might be a workforce we can use here? Are those conversations happening about the staff and the workforce at these big medical facilities that are suddenly finding themselves in the unemployment line like so many others?
So I can't speak to a specific conversation with OSF. I don't know if that's happened. I can say that to one of the first things you asked about, Mark, as to whether the governor has made calls or the governor's office, I can say we've certainly said, to a hospital that may have been reluctant, for example, to take residents in care at the Department of Corrections facility, you have an oath, you have a duty, and you have an obligation under law to do that, not just, of course, to us, but also to help other hospitals that are local distribute resources and make sure that we can keep as many open beds as possible for as many people as we can. To your question, though, absolutely, there we are reaching out. As you know, we're standing up McCormick Place in concert with the Army Corps of Engineers, the City of Chicago. We are reaching out for staff in and around that area, and of course also downstate. We're trying to make sure we keep as many healthcare professionals here as we can, because you may have heard there are massive pay spikes for folks who want to travel to California and to New York. So we're doing, we think, the things we need to do to make sure we're competitive in keeping our workforce here and keeping them working.
Yeah, and maybe for people in our audience who have questions, we're getting a lot of questions about this prison issue and where those inmates should go. There's been some lawsuits as well. We know that most of these prisons do have some medical facility and some nurses and medical professionals hired on staff to treat those inmates when they become sick. What is it about the healthcare facilities at the Department of Corrections that can't handle the COVID outbreak in particular? Can those doctors and nurses not treat it?
So a couple things. One, it's a capacity issue, right? And so, there are infirmaries at most of our Department of Corrections facilities, but those are for some acute care, but not this level of acuity. As your listeners may know from, or watchers, I should say, viewers from talks about COVID, when this gets into your lungs in a really bad way, it is a very, very invasive disease, and it requires generally intubation, ventilation. But by the time someone is in bad enough shape that they need to go to a hospital, they are no longer in a place where they can be cared for in a DOC facility. The other thing is that a DOC infirmary is not meant to handle the volume of patients that we would see if potentially this really, really breaks bad at a DOC facility. So we're doing all that we can. The governor's released hundreds of people already. We are looking at other measures we can take to try to depopulate the facility. We've locked down our facilities to visitors and doing as much as we can to control entrance and egress. Of course, we still have to allow staff to come in to keep people safe. But having said that, we're doing all that we can to make sure that we deal with the issue in the facilities where we can. But insofar as someone is sick enough that they need to be intubated, need a ventilator, they are going to receive the same level of care as any other Illinois citizen, because that is the oath that doctors and hospitals take. And it is our belief that we can't have a separate but equal healthcare system in the state of Illinois.
Yeah, and there's been a lot of discussion around the economic side of this too. We've focused mostly in this discussion so far about the public health side of this, but there's also the side of people who are without jobs. This question has come up a few times now, and I wonder if you can help us understand what is the state's role or what is the current status of the state's effort to overhaul the unemployment website so that because when Congress said, look, if you're a part of the gig economy, if you drive for Uber or if you're a self-contractor, if you're a 1099 contractor, for the first time ever, you now qualify for unemployment benefits through this special disaster relief program. But if those people can't apply for unemployment, they're coming to us in the news, they're coming to you, they're coming to their elected officials and saying, where do I go to get this check? The rent is due, I've got to buy groceries. So where do they go? If they can't go to the state website today, what does a person like that do?
So they should still go to the state website. Now, what I would say is we have people working on this every single day, every single hour. We have moved the website to a cloud service that is more stable. Having said that, as you know, the unemployment claims that we're dealing with both as a state and as a nation are unprecedented. We're having such bandwidth issues across the nation that you're seeing Netflix even throttle and slow some folks down. So I would beg for patience. I know this is scary for folks, but please know that DES staff is working around the clock to make sure that the website is always up, always active, always working. We are not perfect. We obviously beg the indulgence of the people of the state of Illinois. Having said that, we are making sure hour by hour, day by day, people who go to the DES website or call a DES office can get the unemployment benefits that they need, whether they're a gig worker or anything else.
And to add insult to injury, those IDES offices are working remotely, or at least a big chunk of their workforce too. Many of them are dialing in, working from home, as the Department of Innovation and Technology tries to come in. So there's those two issues. There's the bandwidth or the capacity for the website to handle that much traffic. That impacts everyone. But the gig economy workers, that's 1 in 5 nearly 1 in 5 workers in the Illinois economy. There wasn't previously a way for them to apply. Are you saying by telling them to go to the state website that now there is a way that because Senate Republican leader Bill Brady said that could take months still for that new part of the website to be created. Are you breaking news here and saying that they can apply now?
That is fair, and to be clear, DUIT is something that's in my purview. DES is not. My understanding is that's an issue that's being worked on. I know Leader Brady sent a letter about it yesterday. What I'm saying is that that folks are going to need to be patient and stay watchful, and that as more news comes out with that, my imagination is that the DES website is where folks will be able to go to get more information. But happy to check back and get more info to you and your viewers.
Can you give us a timeline on when you expect that new update to be done? And just to be clear, is DUIT managing that part of it as well, or is that an IDES?
Is managing the bandwidth portion of it, making sure that the website has all that it needs to deal with the volume of claims that are coming in. DES is managing what is happening in terms of new parts of the website and that gig employment issue. So let me check back on that. I don't want to give your viewers an answer that I'm not fully informed on.
Sure. And can you provide any clarity to what Senator Brady said, that it could take months? Is there any better timeline on when that could come into clearer focus?
I've been updated on it. I don't know about his timeline. I saw the letter, obviously, but I would want to check with the Department of Employment and Security on that.
All right, very interesting. As we move forward, what are the next steps here? We've seen some anxiety from business owners. Some Republicans have tried to say, look, when the state's ready to reopen for business. I know we're not there yet, but how is the governor's office looking at those steps? We've seen some optimism, he said, looking at the CDC saying, hey, if someone had it, maybe they have antibodies, they've recovered. Perhaps people like that could be some of the first folks to go back into the workforce. What does that ramp up period look like as more businesses are brought back online, whenever that point is down the road? What is the governor's office doing to plan for that moment today? And can you provide any details as to what that might look like?
But look, I mean, the governor has said on all this that he's going to be guided by the science, right? And so I think that you've seen that the guidelines at the federal level got extended. You've seen us extend our disaster declaration a couple of times. I think that folks need to consider that it's going to be a while before life returns to normal. Having said that, we are thinking constantly about what it looks like, what those signals are going to be to turn the economy on. We are looking at new models every single day to figure out what the data says and when we think we're past the curve. But I also want to level set this, and the scientists have said this the world over. What you could see is a situation where we get a handle on this, God willing. We decide to open the economy back up, hopefully as you're sort of nearing the summer, for example, is what folks have said across the world. Not saying that's our timeline here, but then you might see a situation where, because you don't have full herd immunity yet, folks start to get sick again as we get into the fall. You may see another sort of slowdown. So I think it's going to be a while before life fully returns to normal, but we are thinking through what does it look like to make sure that we can provide the care that people are going to need to be able to return to work. And as these antibody tests, serology tests come online, knowing where the virus is, who has immunity, who has had it, who does not, is going to be the thing that guides us forward. So to your point, having some of those antibody tests that are being hopefully approved by the FDA and CDC is going to help us get our arms around who has had this, where they've had it, and who can safely return to work and how.
All right, well, we're rooting for you, because us White Sox fans, we're really hoping to see a return to normal where, for once, usually in a White Sox stadium, you could practice proper social distancing because fans sit far enough apart as is. This was going to be the year we would change that, but I guess that has to wait.
Well, I'm a fellow White Sox fan, Mark, so I'm right with you. I love the pitching. I love the way the team is developed. And I got to say, ultimately, we've still got the best food. Those Cubs fans, it's not the same atmosphere. So I'm with you, and I'm rooting for it the same way you are.
All right, that ballpark dog can't be too far around the corner, we hope. We're hoping for the best in all this. And stay safe, be well. Thank you for signing on and joining us. Deputy Governor Christian Mitchell from Chicago. Thanks again.